Greetings, my name is Dr. Neil Nandi. I wanted to give a brief recap of our symposia entitled Closing Outcome Chasms Through the Effective Management of Iron Deficiency Anemia. We presented this talk at the latest 2022 Advances in Inflammatory Bowel Disease Conference held in Orlando, Florida. I served as activity chair and was accompanied by my colleagues, Drs. Millie Long and Dr. Gary Lichtenstein. Iron deficiency anemia is very prevalent in inflammatory bowel disease. In fact, 16 to 74% of our IBD patients have iron deficiency anemia. But are we doing enough to manage it appropriately? Sure, it's understandable why they're anemic, right? Ulcerative colitis, they have occult overt bleeding, and that bleeding can amount to anemia. In Crohn's disease, it's a different mechanism, a mechanism that involves systemic inflammation. In our talk, we actually highlight not only the pathophysiology of iron homeostasis, but the importance of recognizing this anemia of chronic disease, anemia of chronic inflammation, by highlighting the role of hepcidin. In systemic states of inflammation, hepcidin is upregulated and prevents the physical absorption of iron from the intestine and also the physical release from macrophages and hepatocytes of iron stores so that we have a functional iron deficiency. Therefore, oral iron supplementation is not only going to be ineffective, but may even mildly cause flares. So we have to better understand how can we better address iron deficiency anemia in the active IBD patient. Another reason to recognize the importance of iron deficiency anemia is that it's associated with specific complications. Did you know that iron deficiency anemia is associated with higher postoperative reoperation, higher postoperative sepsis, and overall increased length of stay, and an increase in higher serious morbidity and mortality? So there is a clear imperative to recognize and diagnose iron deficiency anemia better, and then also to treat it. Fortunately, the IBD chorus guidelines have actually specified an algorithm by which to go ahead and properly diagnose iron deficiency and then manage it with either oral or IV iron. Now that comes to the next part, the most important part about management. How do we effectively treat iron deficiency anemia? Now, commonly we use oral iron supplements, but oral iron supplements not uncommonly cause GI intestinal upset, nausea, vomiting, diarrhea, even constipation. But did you know in the inflammatory bowel disease patients, they can sometimes rarely be associated with flare. So when you have active IBD, oral iron is contraindicated. In fact, the anemia is so significant that IV iron is much more effective. Indeed, there have been several head-to-head clinical trials done looking at oral iron versus IV iron and showing that IV iron in IBD patients is far more effective in resupplementation of iron stores in an IBD patient. One common misperception of IV iron comes with from dextrans. Iron dextrans back in the day had a higher risk of anaphylaxis. But did you know that's not so true of modern day iron formulas? These are iron carbohydrate shells that have a slow release formula, and they have a far, 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 far low risk of anaphylaxis. There are multiple different types of IV iron available now that are very safe and very effective. Ferric carboxymaltose, ferromoxitol, and ferric dirysyl maltose are just a few. In our talk, we actually highlight the pros and cons, the advantages, disadvantages of oral iron and IV iron. The most important thing, though, is that we treat and that we also check. And so the IBD course guidelines emphasize that once you do resupplement appropriately the IV iron, you also recheck the iron stores 4 weeks later. If you haven't guessed, this is a very comprehensive talk on iron deficiency anemia in inflammatory bowel disease in the 21st century. We have come a long way when it comes to diagnosing iron deficiency appropriately and then treating it effectively. But the key approach is being proactive. We have to look for it and we have to treat it. I hope you learn a lot from this symposia. And if you have any questions, by all means, please reach out.